The abstract is relative to another phase 2 study, which is another academic phase 2 study led in Milan as a single-site trial with the use of Alisertib in refractory and chemotherapy pretreated urothelial carcinoma. Alisertib is a spindle checkpoint inhibitor, basically it has been developed in lymphomas, in hematologic disease, and also in ovarian cancer with promising signals of activity. And the target is the Aurora kinase A, which is a target which is still poorly understood in terms of clinical impact in urothelial carcinoma, despite a good rationale. And so we developed a phase 2 study with this drug as a single agent for patients who have failed at least one chemotherapy regimen. Unfortunately, the first stage of this trial was the required number of responses was not met, so the study was concluded in up to the first 20 patients. And despite these low signals of clinical responses, we observed very, very interesting signals of possible advantage in overall survival. The median overall survival was not reached after a median follow-up of 8.3 months, so meaning that probably there would be a signal towards an improvement in overall survival for this patient. This is interesting, but the major problem is trying to identify the patients who should be selected for this kind of treatment, which is very, very difficult. We started doing that, sequencing the outlier patients, and some signals of gene mutation that may be linked to clinical activity of this drug are being collected, but at a very, very early stage, so it's too early to state anything so far. So it's too early probably to conclude that this kind of drug, this family of drug is effective in this disease, but of course tolerability was a concern, and was a concern based on the development of on the immunotherapy on the other side in this disease, which is completely changing the scenario of treatment in this disease. So developing anything else outside immunotherapy is becoming more and more difficult in this disease. But interesting signals of long-term survival are being collected with this drug. It's very difficult to identify a next step. Probably the next step may be identified only if we clearly identify an association between a molecular profile or something like that and the response to this family of drug or this kind of drug. Otherwise, immunotherapy so far is a privileged pathway towards the registration as a standard of care of many drugs. So it will be difficult to envision a future for this kind of drug like spindle checkpoint inhibitor in this disease. Basically, we have no option, no conventional option. The only drug which is registered in urothelial cancer after failure of chemotherapy is vinflunine, but only in Europe, not in the United States. So it's clearly a medical need. Clearly, up to 1 year ago, there was nothing circulating in clinical trials, and now there are many new drugs, many immunotherapy drugs, many spindle checkpoint. Many immune checkpoint inhibitors that are completely changing the scenario of the salvage setting. So we don't have any registered drug which is a standard of care, but we'll got so in very few years with something that will change the future of these patients.